Good afternoon, everyone. My name's Mia Collett from Panoramic Associates, and I oversee the Health and Social Care team. And welcome to today's episode of Public Health Spotlight. And today we're joined by Claire Beynon. Claire, if you could please start by introducing yourself.
Thank you. Yes, so my name's Claire Beynon and I'm the Executive Director of Public Health for Cardiff and the Vale University Health Board.
Brilliant, thank you. And can you start by giving a brief overview as to what your role is as an Executive DPH at Cardiff and Vale University Health Board?
Of course. So the Health Board has two statutory responsibilities. One is to make sure that we break even, and the most important one is to make sure that we improve the health and well-being of our local population. And that's really what my job's all about.
Can you please provide a brief history of your journey to becoming an Executive DPH?
Of course, yes. So immediately before I became the Executive Director of Public Health, I was actually the Deputy here. And my Executive Director really trained me very well and gave me lots of fabulous experiences. So I'm very grateful to her for supporting me in this journey. I worked for the Policy and International Health team in Public Health Wales. And before that, I worked as a consultant in public health for Taff University Health Board.
Okay.
But before that, before I did my public health training, I worked for many years in the NHS. So I worked over in Bristol and I was a commissioner of services, and I worked on all sorts of different projects. So cancer commissioning, interventions not normally undertaken, all sorts of interesting experience in the NHS. And the way I got into that was through the Gateway to Leadership programme.
Okay.
So the Gateway to Leadership programme took people from various different backgrounds. So there were people from the military, from the post office, from all different walks of life. And they brought people into the NHS at a senior level. And before I'd been working in local authority. So I'd worked in local authority for many years, working in their leisure services and cultural services. So I had lots of different experiences before I took on this role.
A lovely, varied, colourful career. Thank you.
And I think that's what's really that's what's really important about public health. You have people from so many different backgrounds, and they've got so many different skills that you can mix those skills together and you get a really strong team.
Yeah, definitely. Thank you. And you mentioned that you were a deputy beforehand. How does your role compare now as Executive DPH compared to when you were deputy?
Well, first thing I'd say is it's much busier, but I very much enjoy it. I say I'm busy, but I'm also very happy.
Yeah,
it gives me the autonomy to work with a team on deciding what the priorities are, for example. So since I've been Director of Public Health, we've agreed on a vision for our team and also 3 priorities. So our vision is to reduce health inequalities and improve the health and well-being of our population. And our 3 priorities are around increasing vaccination rates, reducing levels of smoking, and increasing the number of people who are living with a healthy weight.
Right. And how are you getting along with those priorities and visions at the moment?
Really well, thank you. So we're 6 months in and we have a plan for each of those areas. So we've been working really closely with lots of different partners to work up our joint plans. I always say in public health, we never do anything alone. We're a really tiny team, but we make sure that we reach out and work with lots of partners. And we're trying to use a whole systems approach, for example, to tackle obesity. So we work very closely with third sector. We work really closely with our local authority colleagues and also lots of other partners as well. So recently we had an engagement event. We had 160 different people come along from 35 different organisations.
That's great.
And people are really keen to work with us.
Thank you. And in regards to your team structure, how is your team made up within public?
Yeah, sure. So I've just appointed a deputy, so I'll be glad when I get the deputy.
Congratulations.
Yeah, so that's great. And then we have 4 consultants. 3 of those 4 work part-time. Underneath those, we've got a layer of principal public health specialists, and then a whole team of people. So we've got about 39 people in our team. That includes the admin team, who are absolutely essential to making us all run, as well as our practitioners working at various different levels.
Okay, and the next question is, how would you define what a University Health Board is, and how does it compare to the NHS, councils and Public Health Wales?
It is very different here in Wales. So public health is still in the domain of the NHS rather than being set in local authorities as is in England. So that means we sit right at the board on the table, round the table. We're with the other executive directors, so Director of Planning, Medical Director, Director of Nursing, etc. And we are very much part of the NHS. In England, there's a different structure. So the public health obviously sits within local authority, and it can be variable as to whether the Director of Public Health reports into the Director of Social Services or direct to the Chief Exec. I'm glad to say that all the Directors of Public Health in Wales, and there are 7 of us, and we cover 22 local authorities between us, we all report direct to our Chief Execs in the NHS.
Okay.
The NHS in Wales is integrated health boards. That means that the health board is responsible for public health, primary care, secondary care, and in our case tertiary care as well, and mental health too. So it covers the full gambit of all the NHS services under one umbrella, and the benefits of that are huge. So we can really work very closely with our partners in primary care, for example, to think about how we make that shift upstream or shift left, depending on how you phrase it, to make sure that we're bringing prevention onto the agenda.
Yeah, I imagine the partnership is so strong, and the benefits you've mentioned, so thank you. So as well as being a full-time executive DPH, you're affiliated with many wider organisations, such as being an honorary lecturer at the Cardiff University, being affiliated with the Faculty of Public Health. How do you manage your time?
That's a good question. You'd have to ask my family about how do I manage all of these different things. But I think if you ask somebody and they say, always ask the busy person to do something else, don't they? So I think that holds true. It's really important to manage time really carefully. I look at my diary on a very careful basis and see what I can commit to. But I think it's really important to bring the next generation on as well. So that's why I'm really committed to teaching. So I teach both for the Faculty of Public Health and for the local university. And I really enjoy those sessions. I find that I learn something from when I'm teaching, as well as obviously I'm imparting my knowledge about public health. And I think if you have someone that's really enthusiastic about public health, it just brings it to life and makes it more exciting for the students. So definitely. I'm really keen to keep involved in that. And then the faculty in Wales is a really important organisation for us. It's our sort of governing body as such, and it's run by the members for the members, just like the ADPH is. So it's important that you give back as well. And I try to do that through my membership of the Faculty in Wales committee.
Yeah, it's very impressive and inspirational as well. So well done as to however you're managing your time. Well done to that. And you mentioned that aspiring kind of cohort of public health leaders. What advice would you give the next generation of public health leaders as to why they should consider working in Wales?
Oh, there's 2 parts to that question, really. So the first bit is about, how can you prepare yourself for being a Director of Public Health if that's what you'd like to do. And I can't say that I always thought, I must be a Director of Public Health. I knew other people who felt that way and were very driven towards that. But it didn't come to me until much later in life.
Okay.
When I'd had more experiences. And actually I realised all of the bits of my work that I really enjoyed were all the public health pieces, and I hadn't really put that together until much later.
Okay.
So I think just do what you enjoy, and enjoy it along the way. Make the most of every experience. If you can say yes and you've got capacity, say yes to all the different experiences because you learn so much from them. That would be my one piece of advice. And I think really being involved with the ADPH from early on sort of made me realise that I could do it and I was capable of doing it. So one of my previous directors of public health, when I worked in my first consultant role, signed me up as an associate member for the ADPH. And that was a really inspirational and sort of trigger moment for me. So I came along to the faculty meetings, the Association of Directors of Public Health meetings, and really grew in my confidence. I became an associate member, and then I became the associate representative on the ADPH Council, and that gave me exposure to other directors of public health across the whole of the UK. And I learnt so much just from even listening to those sessions, and obviously gave the Welsh view on things as well. Which leads me to the second part of your question around sort of why Wales.
Yes.
So I've partly answered it in terms of Wales is amazing because it's got an integrated health board system. And we cover a lot of the ground under one organisation, so that has real positives and real benefits. And I think that the policy environment in Wales is absolutely fabulous. So we've got things like the Wellbeing of Future Generations Act, which is really groundbreaking policy that we have here in Wales. And I think it's just a great place to work. You know, if we're thinking long term, we're thinking about prevention, Wales is the place to do it.
Brilliant. Thank you very much. And on that note, what is one skill you wish you would have developed, or one thing you would have known before becoming an executive director of public health, if you can answer?
That's really tricky. I'm not sure there's just one thing. I think it's sort of, for me, it was like collecting pebbles, you know, collecting little bits and pieces as I went through my career. So I had so many different jobs before I came into public health, and quite a lot of them involved bits of public health, and I didn't really call it that or know it was that at the time, but you know, reflecting back, those were the things that I enjoyed. So I always say to my kids, do what you enjoy.
It's a great piece of advice. And what would you say the future priorities are for Cardiff and Vale?
Okay, so we've really set out 3 priorities for our organisation in terms of prevention. So one's around reducing levels of smoking. So we're really going to try and get on top of that, because we know that levels of smoking are not equally spread across our population. People who live in more deprived areas are more likely to smoke. If you're exposed to smoke as a young child and you see people smoking, you have those role models, you're much more likely to smoke. So we need to reduce those health inequalities. And the other 2 areas are increasing levels of people who are living with a healthy weight. We know we have a really obesogenic environment across the whole of the UK. If you walk down the street, you'll see lots of advertising for high fat, sugar, salt products. If you are walking down the street, you might now see, for example, more cycle lanes. So I saw a child just a moment ago pedalling along in the cycle lane, and it made my heart sing to see it. Obviously, that child going home from school. So that's really important to us, that we change the environment. We all struggle with, you know, keeping a healthy weight, because we're battling against all these triggers for high fat, sugar, salt foods, and, you know, reducing our levels of activity on a daily basis, whether it's just easier to take the car than it is to walk, or we have to think about things a little more to plan our journey. So we need to be aware of that. And then finally, we need to increase vaccination rates. Again, we see differentials in terms of our vaccination rates across our population. So people from more deprived areas, or people from different ethnic groups, might struggle to access services. So we need to be reaching out to them, making sure that we're making it as absolutely as easy as possible. We're communicating in the way that they want to be communicated to. We've got things in different languages. We've got more accessible services. So we're having a big drive on that at the moment.
That's really impressive. Thank you, Claire. I'm sure our listeners would have gained a lot of insights from your thoughts. So thank you very much for everyone for listening today.